China went through a major health reform several years ago, and part of that process is looking at implementing electronic health record systems in the country.
So there were 12 students that went with us on this trip. The focus was to study how electronic health records were implemented in Minhang District, Shanghai, and also what type of clinical outcomes were changed with the implementation of electronic health records.
So what we did when we were in Minhang is that there were 13 different community health centers, and we visited 12 of them. And we first followed a patient through the health center to understand the patient flow.
We were immersed in these 2.5 weeks in these different hospitals. We had the opportunity to not only talk to the doctors, but talk to the nurses and the patients about their experience, what they liked about their healthcare system, and what they thought could be improved.
After we gathered our information from the Minhang District in Shanghai, as well as from Wenchuan County, we went to Beijing to present our findings to different government officials within the Ministry of Health.
They were great exercises for us to really converse with the people who are involved in the trenches, who are leaders in the field. They wanted to learn what we saw, what we assessed through our US perspective. The boundaries between the US and China in this interaction were kind of blurred because we were thinking, well, many of us are clinicians and we want to give the best care possible to our patients. How can we make this system work best, not only for the hospital, but for the patients that we serve?
Being able to tour around community health centers is not an opportunity that's afforded to many people. And going with our school and being able to speak to physicians, nurses, patients directly about their experience was really interesting and incredibly valuable.
I think one of the most gratifying things during the trip was when the Chinese public health officials would say, we really are going to take your recommendations into consideration, and we want our system to be improved with the data that you found. So when we see that our work over the 2.5 weeks actually has an impact in changing the way things are run in China, that is definitely a great feeling that brought us all together.